We're going to take you to this leading story now. The Mpumalanga Health Department has raised concerns over the growing number of teenage mothers in the province. On Christmas Day alone, at least 25 teenagers gave birth across Mpumalanga. The provincial Health MEC, Sasekani Manzini, is expected to visit Shongwe Hospital in Nkomazi today to welcome the New Year babies. SABC News reporter Tumelo Machogo is at the hospital and joins us now. Tumelo, the MEC is expected to visit the hospital, but what can you tell us about the number of births that had been recorded at the hospital today?
Well, indeed, Oliver, it's a happy new year here for the mothers, but also a happy new year for these mothers that they just gave birth this morning. Here at Shongwe Hospital, 4 babies were born. A set of twins, a boy and a girl, were also born here at Shongwe Hospital. So it is an exciting moment, especially for the mothers that are here, because they've also received presents from the MEC, that Sasekani Manzini, that also arrived here this morning. These are the presents that she has also delivered to the mothers that have gave birth this morning, since the early hours of this morning. But let's now speak to Goodness, who gave birth to twins. Goodness, just talk to us. Congratulations. Just talk to us about how do you feel about giving birth on this special day.
Thank you. I'm happy. I'm so happy. I don't know what to say. First of all, I like to thank God because He gave me a second chance to live. Some of my friends are dead. So I'm so happy they gave me a care that I didn't expect when I got to C-section. So I'm so happy. I'm so happy. And also the presents they give me, I appreciate it.
And also the baby looks healthy. They look beautiful. Do you have names for them already? And also what is the plan for them for when they grow up?
Yes, they do have names. The boys, Ayabongwa. The girl, it's Aviwe. So I wish my children grow up, have a good future, see them growing up. One of the good days, we're going to be a president or some doctor for the future. Yes, thanks. I'm so happy. Thank you.
Fantastic. And somebody's trying to call you to congratulate you there. And also, let's speak to you. Also, you gave birth. On this day, and then
ngijabule kakhulu ukuthi ngimthole umntwana bengaka expect ukuthi ngamthola ngelanga leli lanamuhla lokhu ngijabulise kakhulu netipho lengititholile ngijabulisile ngisina kakhulile ngifisa ngathi angaba ngidokotela.
Fantastic. There, Oliver is saying that, she wishes that her son also, when she grow up, can become a doctor and also, help people, especially mothers also, who come and give birth here. But also these are like some of the nurses that were helping these mothers since this morning to try and, help them with the process of giving birth. But now let's speak now to the MEC of Health in the province, Sasekani Manzini. Talk to us about the numbers of babies that have been born in the province since the early hours of this morning, and also what time did the nurses and doctors started working?
No, thank you very much, and Happy New Year. Compliments for the new season to yourself and your team, and also the viewers at home. Indeed, we are here now at Shongwe Hospital, and we must say that so far we've got 50 babies in the province delivered from 12 o'clock, and the first baby is in Witbank Hospital. The last time Premier was in Witbank, he wanted the first baby. The first baby was not in Witbank. Now we are here at Shongwe, and the first baby is in Witbank. So we can say that 23 are male and 27 are female, but also of a challenge that we always discuss during this time, and also that we are monitoring as department and as government, is the issue of teenage pregnancy. Because now, so far, we have registered 1 teenage pregnancy of 14 years at Temba Hospital, and it's a very serious matter that this government, from the side of the Department of Health, we need to fill a form called Form 22, so that we can take those forms to Department of Social Development, so that they can process it, so that they can deal with it with your justice, your SAPS. But we must indicate that as a province, we have recorded 9,712 teenage pregnancies, but also out of that are those that are above the age of 17. Remember, statutory rape is up until your age of 16. So the number also indicate those that are above 16 years. So, but this is a program that we are going to work with as a cluster. meaning your social development, your Department of Health, your justice, your SABC, so that as provincial government will be able to deal with these cases. And also, we can also indicate that we are working very well with our traditional authorities in the province so that the message is the same.
Are you saying that 9,000 teenagers gave birth in the province just this year? And also, when are you opening cases, especially for statutory rape? Because obviously this is crime, and then if the young mothers are giving birth, they should be reported to the authorities.
Yes, as I've said, the 9,712 include all teenagers, even those that are above your 16, 17, 18. So, of course, the role of the Department of Health is not to open cases, it's to fill a form called Form 22. Then we take it to social development. Hence, I'm saying it's a collaborated process that we are working on as government, so that we can be able, of course, it starts with the family, and then it also comes to us when they deliver, because we have the records. As far as these are the teenage pregnancy or deliveries that we have recorded. So from there, you don't implement the opening of cases, you take it to social development. Hence, we are saying that as provincial government led by the Honorable Premier, we have looked at this matter and how we are going to process it. So we are going to take this report now that is the end of the financial year, also so that we are. What is good is that it falls under the social cluster that include health, education, social development. So we'll start processing it at the level of the cluster, so that therefore we take it to ESCO as far as how far are we in terms of the implementation of these teenage pregnancies that we are seeing, and the intervention therefore, because if it's a provincial government, that's where it will also put intervention as far as how do we deal with the teenage pregnancies in the province.
Also, do you think this is the problem of maybe like lack of education? Why are these or not the message getting into to teenagers, especially with education when it comes to prevention, when it comes to using protection, and also even when it comes to young people engaging in sexual activities?
Yes, we are correct. Remember also, as a Department of Health in our clinic, we make it youth-friendly zones for these teenagers, most of them who are still at school. So when they go to our clinic, we don't also allow them to follow the normal cues, because we understand that while we are still waiting, you might see your neighbor, you might see your pastor, any other person. Then to explain all these things, of which we always say that people say government is encouraging young people to involve themselves in sexual intercourse at an early age. But the reality is that these are the numbers of teenage pregnancies. So we need to work very well with the community themselves, the parents, because once you take this program to the community, some community resist. Remember, even when you want to take it to school, parents will say, we are teaching our children to start with sexual intercourse. So these are the realities that we must work together. Hence, in a rural province like Mpumalanga, we work with our traditional authorities, so that once the traditional authorities understand this in their meetings and everything, it becomes easier for the parents to understand. So this work needs all of us. Families, this happens in the families. Some are family members, are parents, some are uncles and neighbors, everyone else. So we need to work together so that we deal with this teenage pregnancy, because some of them are part of the gender-based violence that we need to deal with. Hence, the Premier launched the council, because that's where you discuss all, even this report becomes part of how do you then collaborate with all the key stakeholders and deal with the teenage pregnancy that we believe robbed us of the future of our children. And we believe that even yourself, now that you are discussing it with us, the community are listening, so also they'll become part of how do we deal with the teenage pregnancy in the country.
MEC, just maybe talk to us about yesterday. It was New Year. Obviously, a lot of hospitals are inundated with like a lot of incidents and accidents. How was the province? How did they deal with those kind of incidents overnight?
Yes, you know, with us, we don't take leave, so we are always ready. I've seen on social media, some people will take me and say, MEC, there's one doctor, and also, no, that is not the case. We have managed it in a way that all our facilities, we know who's on duty. You see, the HOD is here. You see, I'm also here. So each and every person have their own roles. Like I'm saying, I also manage complaint during this time. So we are all knowing very well that we'll rest after, maybe after today. I was given a leave by the Premier, but the leave is just 50% leave, but you must always work. So we are working, all of us. So you know very well, even the Premier is working. So we are always, when I was on my way, he was calling me, how many babies? So you can see that all of us, we've got interest, we are working. So the matter that we will find doctors, they know that I'm a doctor, I chose to be a doctor. I'm a nurse, I chose to be a nurse. I'm a cleaner in a hospital, I chose to be a cleaner. I'm a security. So the whole team, hence we have a contingency plan. It don't come by accident. We manage it, we plan, and we know who's working by what time. So we work very well, but we must say to our people, continue to take care of yourself. The Premier was also complaining about accident on the road. They end up in our facilities. Just take care of ourselves and enjoy a happy new year, and God bless all of us.
And also the numbers were very high, especially when it comes to incident and fatalities on the road. The province is actually quite high. The numbers of babies that have been born so far in Mpumalanga are 50. 27 of them are girls, and then 23 are boys. So you can imagine, Oliver, these mothers, they're quite excited about giving birth on this particular day, because it is an important day. Also, it's the first day of the new year. So these mothers are excited. Most of them now, they're already on their phones, obviously talking to their families to congratulate them on the birth of their babies.
Tumelo, thank you so much for that. Really do appreciate it.